In the complex ecosystem of healthcare, where patient lives and operational efficiency intersect, healthcare administrators serve as the unsung architects. These professionals ensure that hospitals, clinics, and other medical facilities function smoothly, balancing patient care with organizational needs. The job description of healthcare administration is multifaceted, blending leadership, logistics, and a deep commitment to improving lives. Let's explore what this role entails, the skills it demands, and why it's a cornerstone of modern medicine. What is healthcare administration? Healthcare administration involves overseeing the business and operational aspects of healthcare facilities. Unlike doctors or nurses who directly treat patients, administrators work behind the scenes to create an environment where clinical care can thrive. They manage budgets, coordinate staff, ensure compliance with regulations, and keep the facility running like a well-oiled machine. Whether in a bustling hospital or a small outpatient clinic, their work touches every corner of the healthcare experience. Picture a healthcare administrator as the conductor of an orchestra. They don't play the instruments, but they ensure every section, nurses, doctors, billing teams, and maintenance staff, performs in harmony. Their decisions impact everything from patient wait times to the availability of life-saving equipment, making their role both strategic and indispensable. Core responsibilities in focus. The job description of healthcare administration spans a wide range of duties, each critical to the facility's success. Here's a closer look at what these professionals handle daily. 1. Financial oversight. Administrators manage budgets, oversee billing processes, and negotiate contracts with suppliers or insurance providers. 1. They ensure the facility remains financially viable without compromising care quality. 2. Staff management. From hiring and training to scheduling and conflict resolution, they lead teams of healthcare workers. 2. This includes ensuring adequate staffing levels during peak times and fostering a supportive work culture. 3. Regulatory compliance. Healthcare is heavily regulated, and administrators ensure their facility meets local, state, and federal standards. 3. This might involve updating policies, preparing for inspections, or managing patient data security under laws like HIPAA. 4. Facility operations. They oversee the physical environment, coordinating maintenance, ordering supplies, and upgrading equipment. 4. A broken MRI machine or a shortage of gloves falls under their purview to fix. 5. Patient experience. While not clinicians, administrators shape how patients interact with the facility. 5. They might streamline appointment systems, address complaints, or implement programs to improve satisfaction. These tasks require a blend of analytical thinking and people skills, as administrators juggle numbers, policies, and human needs in equal measure. Skills that define success. To thrive in healthcare administration, certain abilities stand out as essential. Leadership tops the list. Administrators must inspire teams, make tough calls, and steer their facility through challenges like budget cuts or sudden patient surges. They need to communicate clearly, whether negotiating with vendors or briefing staff on new protocols. Analytical prowess is another must. Reviewing financial reports, interpreting compliance guidelines, or analyzing patient flow data demands a sharp mind for detail and problem-solving. A healthcare administrator might spot a trend, say, a spike in canceled appointments, and devise a solution before it impacts revenue. Adaptability is key in an industry where change is constant. New technologies, shifting regulations, or unexpected crises, like a pandemic, require quick thinking and flexibility. Emotional intelligence also plays a role, as administrators handle stressed staff, anxious patients, or frustrated families with empathy and tact. Finally, a foundational understanding of healthcare, its terminology, processes, and ethics, helps them bridge the gap between clinical and administrative worlds. While not mandatory, many administrators pursue degrees like a Master's in Healthcare Administration, MHA, to sharpen these skills. A day in the life of healthcare administrator. Let's follow Maria, a healthcare administrator at a mid-sized community hospital. Her day starts at 8 a.m. with a leadership meeting, where she reviews last month's budget and discusses a plan to replace an aging X-ray machine. By 9:30, she's walking the halls, checking in with department heads. Nursing needs more staff for the weekend, and the lab is low on reagents. She jots notes to address later. At 11 a.m., Maria meets with the billing team to troubleshoot a glitch in insurance claims processing. Lunch is eaten at her desk while she signs off on a new handwashing protocol to meet state guidelines. By 2 p.m., she's on a call with a supplier, negotiating a bulk discount on surgical masks, a small win that saves thousands. Mid-afternoon, the job description of healthcare administration comes alive when an doctor flags a bottleneck in patient admissions. Maria dives into the data, identifies a staffing gap, and adjusts the schedule for the next shift. Before leaving at 5 p.m., she responds to a patient email about long wait times, promising to investigate. Her day is a whirlwind of decisions, each one shaping the hospital's pulse. Challenges and rewards. Healthcare administration isn't without its hurdles. The pressure can be intense, balancing tight budgets while maintaining care standards often feels like walking a tightrope. Regulatory changes can upend plans overnight, and staff shortages, a persistent issue in healthcare, demand creative solutions. Add in the emotional toll of working in a field where lives are at stake, and it's clear this role requires resilience. Yet the rewards are profound. Administrators see the direct impact of their work: shorter wait times, happier staff, or a new piece of equipment that saves lives. There's satisfaction in solving complex puzzles, whether it's cutting costs without cutting corners or streamlining a chaotic process. For those passionate about healthcare but not drawn to clinical roles, this career offers a way to make a difference. Why healthcare administrators matter. Without skilled administrators, healthcare facilities would falter. Doctors and nurses might be the face of medicine, but administrators are the backbone, ensuring resources are available and systems work. They're the reason a patient gets a bed in the a surgeon has sterile tools, or a rural clinic stays open despite thin margins. Their influence extends beyond operations to community health. By managing outreach programs, securing funding, or partnering with public health agencies, administrators help address broader issues like access to care or disease prevention. In a world where healthcare costs and demands keep rising, their strategic vision keeps facilities afloat. Pathways and opportunities. Entering healthcare administration often starts with a bachelor's degree in a related field: business, health sciences, or public administration. Many advance with an MHA or MBA, which opens doors to higher roles like hospital CEO or department director. Entry-level positions, such as administrative assistants or department coordinators, offer a foot in the door, with experience paving the way up. The field is growing, too. As populations age and healthcare systems expand, demand for administrators is projected to rise, offering job security and variety. Salaries reflect the responsibility. Entry-level roles might start around $50,000 annually, while seasoned administrators in large hospitals can earn six figures. Technology's role. Modern healthcare administration increasingly leans on technology. Administrators use electronic health records, EHRs, to track patient data, software to manage budgets, and telehealth platforms to expand services. Staying tech-savvy is now part of the gig. Maria, for instance, might oversee the rollout of a new EHR system, training staff and troubleshooting glitches. This tech integration enhances efficiency but adds another layer to an already complex role. A career of impact. For those drawn to healthcare administration, it's a chance to blend business acumen with a mission-driven purpose. The role demands a head for numbers, a heart for people, and a stomach for pressure. It's not glamorous, there are no dramatic operating room moments, but it's vital. Every policy tweak, budget adjustment, or staff hire ripples outward, touching patients and communities in ways both seen and unseen. Conclusion. Healthcare administration is the engine that powers medical care, a role that marries strategy with service. From managing crises to fine-tuning daily operations, administrators ensure the system doesn't just survive, it thrives. The job description of healthcare administration may evolve with time, but its essence remains: to support healing by mastering the details. Whether you're reading this or watching it unfold on screen, one truth stands out: these professionals are the quiet force keeping healthcare alive.